16th annual White Coat Ceremony, and it's customarily the student's role to talk about what the white coat means as a student. But I'm formerly a liberal arts kind of educated guy, and I feel strongly that in order to understand what something means, it's important to understand where it comes from, what its history is, how it originates. And the history of the white coat is actually fascinating. There are a few different treatments written by medical historians on the subject, but one of the most interesting ones that I read noticed a really specific difference between two paintings by the same guy, Thomas Eakins, around the turn of the 19th century. And the first one is called The Gross Clinic, and it is a beautiful, I'm sorry I don't have the paintings here, I'll try to paint you a mental portrait. It's of a surgical clinic at Thomas Jefferson Medical College in Philadelphia. And it's of a patient that is receiving surgery, I think on his hip. And the physicians attending to that patient are dressed entirely in black. They have formal suits on, no gloves, no masks. They're leaning over this patient in their very black attire. And it's interesting to note that at that time, much like today's tuxedo, black was the color of formality. It's a color that denotes austerity, that has a relationship to the graveness of what was happening, because most of the time, in those days, physicians attending to patients would call to the bedside when matters were already very grave, and when there wasn't a tremendous amount that could be done. And the traditional black of the physician, much like the traditional black of the clergy at that time, was a sort of association with mortality that doctors had to interact with all the time. Then the other painting is only 4 years later, just down the road, actually in Philadelphia, for those of you familiar, at the University of Pennsylvania, and it's called The Agnew Clinic. It was also painted by Thomas Eakins, and it's a very similar painting. It's again of a surgery, and the striking difference is that all of the physicians attending to the patient are dressed in white. And it's only 4 years later, same patient, same place, new dress. And the question is, what happened? Right? In those 4 years, why the change? And there are a few competing theories, but one of the interesting things that has been brought up is that a guy named Joseph Lister, Baron Joseph Lister, was first popularizing antiseptic technique in Britain at the time. And what Joseph Lister was actually the namesake of Listerine, for all of you interested in medical antidotes. What he found was that by sterilizing surgical instruments with phenol, you could reliably reduce the rate of post-surgical infection after surgery. Right? And not only was this something that he demonstrated, it was reproducible. And so the white coat was born out of antiseptic technique, where for the first time, physicians started to wear white to reveal sources of contamination and dirt that could possibly be introduced during surgery. And so this is a practical transition, where we started to don the white coat as a means of displaying any possible dirt or contamination. But it's also very importantly a metaphorical transformation, because what Dr. Lister was able to do was actually demonstrate through a nascent scientific process a reproducible result by altering a single variable. And so, to a certain degree, that moment in medical history is a very specific transition away from that kind of clergy of the body and the graveness and the mortality of the physician to a kind of more hopeful, more truthful, more scientific sort of garb. And it's worth noting that the Latin word for white is candida, which is important, as you will learn, for microbiology, but also is the derivation of our word candid, right, or truth. Right? So again, the white coat has now this metaphorical meaning for truthfulness, away from kind of a faith-based system and into a more scientific process. And we wear our white coats these days now as sort of a bow to that important moment. But at the same time, a tremendous amount has changed from 1875 to today. And the white coat is, for whatever it was at that time, is no longer the same symbol. I remember really specifically my first experience wearing a white coat. I went to, you guys will all be set up with community mentors eventually. My community mentor was an emergency room physician, and my first day going to my community mentor, got my white coat on, I got my stethoscope on, I was all excited. But I actually had no idea how to get into the emergency department. So I did what anyone does. I just walked into the waiting room, in the patient area. And I kind of wandered around looking a little bit lost. And the security guard waved me over, and I was like, oh no, here it is, I've been caught. You know, I had this whole thing as I was walking over, somebody like, listen, I'm actually a medical student, I'm supposed to be here, just gotta ask this guy, Dr. Terry Forcada, trust me, he'll tell you that he's waiting for me. But I walked over, and the security guard just looked at me and said, this way, doctor. And he waved me right into the emergency department. And this was it. That blew my mind. That was a crazy moment. Because I was no different than I was 3 months before that. Right? I was still me. The only difference was that now I was wearing a white coat. And it's a key, it's an entry. Right? It means that you are officially a member of the medical community. So not only security guards, but also patients are going to treat you very differently than you're used to treating solely because you're wearing a white coat. They're going to tell you things they've never told anyone, ever. They're going to be more vulnerable in front of you than they would ever be in front of a stranger. They're going to go home and they're going to do exactly what you tell them to do, simply because you told them you were wearing a white coat. And I really hope that you're honored by that privilege. Right? Because it's a rare one and it's a special one, and it's the birth of the doctor-patient relationship. Right? The coat, to a certain degree, represents a trust that you will get nowhere else. And so you should, when you put this on, when you first go to your community mentors, and when you confront patients, you should really be wary of that. That's a really amazing privilege. It's one of the most special things that you'll experience in medical school. But at the same time, the white coat is a sword with two edges, and it cuts both ways. It absolutely goes without saying that patients will sometimes be a little bit afraid of you because you're wearing a white coat. Right? It's a little bit of a barrier. It's dehumanizing to a certain degree. You're no longer a person. You're now an authority. Right? You can be something, for whatever reason, associated with a problem that they've had before with somebody who was wearing a white coat. Right? Or you're going to be sort of associated with maybe being in the way of that patient and what they want or what they need for relief. You'll find when you do your third-year clerkships that pediatricians don't wear white coats for the most part in their clinical practice, because if there's one thing that a toddler learns really early on, it's that people in white coats give you shots. They smell like hand sanitizer. They stick things in your ears, right, when you don't want them to. Right? And if you ever want to examine a 2-year-old, you should probably not be wearing a white coat because they run screaming. Psychiatrists also, at times in their practice, don't wear white coats. For those of you who have ever seen One Flew Over a Cuckoo's Nest, there's really no nightmare quite so profound as cool and calculating people in white coats who pretend to be your friends and actually strip you of your autonomy and your self-determination, hold you against your will, and do things to you that you would never want done to yourself. So again, the symbol of the white coat now has two meanings, and you should be wary of that every time you put it on. And so here's the thing that is slowly revealed in medical school. Medicine, like everything, is imperfect. Right? It has the power to heal, it has the power to hurt. To a certain degree, medical school, or Alpert Medical School, is entrusting you with a very powerful tool. Right? A tool that can do harm and it can do miracles. Medical education. And we're trusting you because we believe that you have the capacity. When given that tool, you will know how to wield it to do the most good. And the irony is, it has absolutely nothing to do with the white or anything that we teach. It has everything to do with what you already have sitting here and what you brought to medical school with you. Right? The thing that's going to allow you to take the tool of medical science and apply it to the most good is your compassion. It's your heart, it's your ear, right? It's your humanity. And those are things that no one can really teach you. Those are things that you have already. And so the best analogy that I can come up with to demonstrate what I really wanted to tell you about the white coat is simply this, that you are all Superman. And what I mean by that is that there's no actual difference between Clark Kent and Superman. Clark Kent, walking around, has all of the powers of Superman, right? But he's got to duck into a phone booth and put on some spandex and take off his glasses to perform the good that Superman does. And to a certain degree, the same thing is absolutely true of all of you sitting here. Right? all the things that are going to allow you to be the best doctors you have. Okay? It's sitting there. You just get to now put on the white coat to demonstrate that good to the world. So what I really wish for you more than anything is to remember where you are and who you are right now. Because medical school will change. There's no question. Now, you won't be the same person 4 years from now standing up here that you were 4 years ago sitting there. But what I hope for you mostly is to remember the things you care about. Remember who you love and why you love it, what you love and why you love it. Because those things, those are your superpowers. Those are the things that make you Superman. And now you just have to wear the standards. And you don't even need a phone. So again, it is absolutely my pleasure to welcome you to your white coat ceremony. And now it's absolutely my honor to introduce to you our Charles O. Cook Distinguished Visiting Lecturer. Excuse me while I introduce him. His name is Dr. Preston Calvert. He's a member of our Brown class of 1976 and the Brown Medical School class of 1979. After Brown, he trained in neurology while on active duty in the U.S. Army at Walter Reed Army Medical Center, and then as an Army-sponsored fellow in neuro-ophthalmology at the Wilmer Eye Institute at Johns Hopkins Hospital. Dr. Calvert served for 15 years total in the U.S. Army, serving as Assistant Chief of Neurology Service at Walter Reed, among other positions. He finished his service with the rank of Major. On leaving the Army in 1990, he entered private practice in neurology and neuro-ophthalmology in Virginia until he became the Vice Chair of Neurology and Director of the Neurology and Neurosurgery Outpatient Clinic at Johns Hopkins Hospital in 1998, a position he held until 2000. Dr. Calvert also serves as Assistant Professor in the Department of Neurology at Johns Hopkins School of Medicine, where he is active in teaching medical students and residents. In 1998, he shared the General Claire Chenault Award at Walter Reed Army Medical Center as its Outstanding Medical Staff Member. And in 2000, he was the recipient of the Johns Hopkins Neurology Residence Annual Teaching Award. Dr. Calvert is a Fellow of the American Academy of Neurology and a Fellow of the North American Neuro-Ophthalmology Society. He has served on the Board of Directors of the North American Neuro-Ophthalmology Society since 2002 and as President of the Society from 2010 to 2012. He currently serves as its Executive Board Chairman. Dr. Preston has served as class representative for the MD class of 1979 since 2006 and on the Board of Directors of the Brown Medical Alumni Association since 2008. He is currently the President-elect of the DNAA Board. Please welcome with me Dr. Preston Calvert.
Thank you very much. I hope you can hear me okay. I have to tell you first,